Hello, everyone. Natural treatment for functional digestive disorders is a very vast topic. Is there any standard protocol in natural therapies that has been developed? Well, we are going to explore Coherent Method, an open source framework for management of digestive issues. I am Amita from Nourish Talk, a platform for natural and holistic therapies. Presenting this session, we have Dr. Matt Marturano, who is a naturopathic doctor for the last 15 years. Dr. Matt has developed Coherent Method for the natural treatment of functional digestive disorders. He's going to share his research and talk us through his framework. Welcome, Dr. Matt.
Thank you, Amita. Thank you so much for having me. And thank you for all of those of you who are watching today and also on the recording. And so I wanted to start by speaking a little bit to how the Coherent Method came about. So basically, shortly after I graduated from naturopathic medical school in 2004, and I opened my practice, I started seeing a lot of people who had all sorts of digestive problems. And even though my training in school had given me a huge amount of tools that I could use to help people, I found myself really struggling to decide, well, which one should I use and which should we do first, and what order should we apply these? And so the Coherent Method is a way that I created to help us organize our thoughts. As we get into it a little bit more detail today, we'll find out a little bit more about what each of the letters mean. So coherent is an acronym, and how to view them as a different area, venue, or a little playground to work with our patients. And that can also provide us not only more direction, but also the ability to pivot. So if we get stuck in treatment, the ability to look in a different area and see if we can get things moving again. So I wanted to start with a little bit of a definition of what we call functional GI disorders. And so the Rome 4 criteria was published now almost 5 years ago. And what the researchers have concluded is that functional GI disorders, and this is things like dyspepsia, irritable bowel, acid reflux, it could be alternating diarrhea and constipation, but they're disorders where a patient has gone to the gastroenterologist, perhaps they've gotten a workup done, maybe they've gotten some scopes or additional testing, and we don't see anything amiss, or at least we don't see anything traditionally that we would consider to be amiss. We don't find anything like cancer. We don't find polyps. Their blood work comes back normal, at least on the basic tests, but still they're feeling very uncomfortable. And what we've realized about functional GI disorders is that they're disorders of gut-brain interaction. And so in our gut and in our brain, obviously, we think about our brain and the central nervous system as being the core of where our neurology functions. But actually, we have a whole second brain in our gut, and even a third one around our heart. And these are all talking to each other all the time. And what happens is when these two parts, our gut and our brain, can't talk to each other correctly, or the message is getting confused, that's how we start. That's how we end up with a functional GI disorder. And so there's 5 basic characteristics that we're looking for. One is motility disturbance. So is a patient having bowel movements more or less frequently than we would expect? And typically, ideally, we like to see one a day. Although for purposes, for example, of official diagnosis of constipation, people would go 3 or more days without a bowel movement. But motility disturbance is something that's a little bit broader than that. So when we're seeing, less than 1 bowel movement a day or more than 3, we're going to start thinking about motility disturbance. The other thing is visceral hypersensitivity, which this means is that their gut hurts. They experience pain, they experience discomfort, but it's more than we would expect to find. So, for example, if somebody eats, say, a big bowl of popcorn with butter or oil poured all over it and a lot of salt, we might expect that they have a stomach ache. Or if someone eats a big bowl of ice cream, we might expect that they would feel uncomfortable. But if someone just starting their morning out with, say, some overnight oats with a little bit of nuts and some berries in there. Well, we wouldn't really expect that to cause pain or discomfort. So visceral hypersensitivity is the idea that we're seeing pain or discomfort at a threshold that's much lower than we would normally expect to see. The third thing is altered mucosal and immune function. And a lot of times we can't see this right off the bat. This is getting into a little bit more into some detailed lab work that we might run. But in other words, it's some things that you might see, for example, are production of a mucus, that you see mucus coming out in the stool. And also changes in immune function that we might not normally think could be connected to the gut. For example, people could have a flare-up of allergies, or what we think is just allergic rhinitis, and we might be thinking it's something in the air, but it actually has to do with some of the things that are going on with the immune system in the gut. The fourth thing is altered gut microbiota. And this can be very difficult to measure because if we don't have a good baseline of what was normal, or at least normal for that person, then we're not sure if it's been altered. And even though we've done a lot of work over the years in characterizing gut microbiota, there's still a lot more work to do in learning about different enterotypes. So are there 3 or more classes of types of microbiota that we see? Are there changes that occur across the life cycle? Are there changes that are different based on culture or geographics, or what our base diet might be? And the answer is probably yes. But the point being is, if we know where we're starting from and then we see a change, that change tends to be associated with these other symptoms. And then finally, there's altered central nervous system processing. And what that means is that people can experience difficulty with their memory. They can experience difficulty processing emotions. Their personality might even change. One very interesting little story to share was from a patient I had who was having recurrent Clostridium difficile infection, and she eventually went under a fecal microbiota transplant. So that's when we actually take fecal matter from a healthy patient, and we transplant it into the diseased patient. And this patient reported actual changes in her personality. And these are characteristics that we would usually think are probably not that changeable, or at least for some of us who might be trying to make changes to our personality, this is something that's very difficult to do and takes a lot of work. But in this case, what we see is that simply changing the microbiota over can cause changes in someone's personality. Now, most of the time, these start to revert back to baseline around 3 to 6 months. But just the fact that they can change something that we would consider to be part of our identity, I think is really important. And this is part of the whole shift that we have into changing our sense of identity from an I or an individual to really a we, where we're considering not only ourselves, but the entire set of microbes that live in and on our bodies. So it's always great to see if we can reframe problems as opportunities, right? And especially for your practice, this will give you new avenues to reach out to patients and ultimately to help them. And so this slide is a little bit old now, but it was basically looking at a 20-year period from 1993 to 2013. And I think it's fair to be able to extrapolate that these trends have continued over the last 7 years. But hospitalizations for functional gastrointestinal disorders, by the way, this is United States statistics. So I'm sure we would see similar things in other countries, but I don't have that noted on this slide. But the hospitalizations went up almost 25,000 to nearly 200,000 annually. And keeping in mind that these are conditions that don't really require hospitalization. In other words, they're not life-threatening, they're not very serious, but they cause enough distress, enough frustration, enough concern that people are showing up at the hospital. And the cost per discharge in the US went up from nearly $6,500 to just over $24,000. And so that's quite a bit of expense that we're looking at burden to be shouldered by the healthcare system and also insurance companies for people that don't have conditions for which a hospital can really help them out very much. The length of stay was fairly stable, but what we were seeing too is that many of these people were admitted from the ER. So again, the types of symptoms that they're experiencing are very distressing. They feel that something is definitely really wrong with them, and they're going to the emergency room for treatment, but they don't have an emergency. And this not only increased the costs of care for the patient, but it also makes it more difficult to get the type of care that they need. They could end up leaving the hospital with a prescription or even a psychiatric medication in some cases that doesn't really address the cause of what's going on. And also, we need to think about the resources that are being taken away from others who really do have an emergency, and they might be in a life-threatening situation. And when they come into the ER, it takes longer for them to get triaged and to get the care that they need. And so after all of this, people showing up in the ER, becoming admitted to the hospital, tens of thousands of dollars being spent on their care, they leave, and their diagnosis, most common diagnosis, was constipation and abdominal pain. And I'm sure if you've been working with these patients at all, you know that these are very broad and general diagnosis. It's barely a diagnosis. Really, all it is that we've heard your symptom, and then we repeated it back to you. And we said, yes, this person reported abdominal pain. Indeed, we confirm they have abdominal pain. We call that a diagnosis. But that doesn't really get us down into the nitty gritty as to, well, why are we having constipation or abdominal pain? So just a note on the Coherent Method in general, this work is licensed under a Creative Commons license. What that means is this is an open source method. It's not proprietary. I give lectures on it in institutions and professional training online and in person, but I don't offer any specific types of certification. I don't require anyone to go through a specialized training to start using it, and the reason is because it's something that grows over time, and it's something that's adaptable. It's really just a framework. So if you want to use this, if you want to talk about it, write about it, blog about it, use it with your patients, develop tools, you're more than welcome to do all of that. All that I ask is that you would attribute me as the original author of the method. So I want to give you a little bit of historical context. So when we get into more detail, if we do one of the in-depth trainings, we're going to spend almost an hour looking at the history and learning about how different approaches to medicine from different cultures all throughout history come to bear on this method now. So we look at ancient Egypt, we look at China, we look at India, and also some of the medicinal traditions that we've inherited from Europe in the United States. And so this is really the last slide in that whole thing that we're going to look at. But it's so important because I think that it's framed everything, at least in Western medicine, that's come in the 75 years since. And so René Dubos, who was a French-born scientist who came to the United States, and a lot of his work at the beginning of the 20th century was done looking at different media to grow microbes. And so what if we can grow this thing on a regular agar? We've used chicken broth. What can we do to grow and culture microbes so that we can understand them? And his work eventually branched out, and he became a very well-respected scientist. He's actually the originator of the phrase "think globally, act locally." If you've ever heard of that one. Mm-hmm. And in this presentation, he was presenting to the Rockefeller Society in 1945. And in the open, he said that there are theoretically several independent avenues approach to the problem of chemotherapy of infectious diseases. Now, keep in mind, at this time, the word chemotherapy just meant drug therapy in general, not just like anti-cancer medications that we might think of them now. So looking at different types of drug therapies, or he was presenting to what eventually was the nascent pharmaceutical industry. And he gave 3 ways that we could help people using medications. And of course, if we think about using food or nutrition or herbs or other interventions, really the avenues of approach are the same. And the first is to stimulate innate defense mechanisms. In other words, increasing the body's innate immunity and ability to stave off infection. I think that this is more poignant now than ever in the world we live in now, where we're all facing coronavirus, and we're thinking about vaccines. We're thinking about other treatments once people get coronavirus, but that's all a part of what we call adaptive immunity. Adaptive immunity is the branch of our immune system that kicks in once we've already gotten sick, or once a virus has gained access, for example, into our system. Innate immunity is what stops us from that virus from getting in the first place. And ultimately, if we think about coronavirus, other pandemics, and we think what's coming to us on the horizon with climate change, this is likely going to be the first of many pandemics that humanity's going to be challenged with. And ultimately, we're going to have to think of other things to do besides just wait for a new vaccine or wait for a new treatment that comes out. We're going to have to think about ways that we can get our innate immune system functioning, so that way we're not only blocking one virus, but hundreds of viruses and bacteria and parasites all at the same time. And so the second avenue of approach that they were talking about was decreasing the toxic manifestations of disease. So in other words, even if we get sick, what can we do to help a patient to feel better, to be able to still function as well as they like, and to limit the disease progress, so that way it doesn't get into something that's potentially life-threatening, or that is turning into a bigger problem. And then the third avenue of approach was killing or inhibiting the growth of infectious agents. So can we simply just kill the bacteria or inactivate the virus that's in the body? And I think the interesting takeaway from this is that it's been 75 years, and the pharmaceutical industry has pretty much only focused exclusively on the third. That is medications that we give people to either kill or inhibit the growth of infectious agents. Drugs are exceedingly poor at stimulating an immune response. We have some new biologicals that have come online in the last 15 to 20 years, and those are tools that we have. But for the most part, we can't get drugs to do something or to promote a certain process in the body, because drugs usually act by blocking a certain chemical pathway. And that's also the reason that they have a lot of side effects, is because that chemical pathway is usually going to be used in more than one place. And we can't decide, we really wish we had the ability to, but we don't yet have the ability to have a drug only work in one specific place. And this is part of the reason why medications come with all sorts of side effects, and why many people discontinue taking them when they started, or why they're concerned about taking them in the first place. By contrast, when we work with people on things like nutrition and diet, those are some of the things that help to stimulate our innate defense, or things that we can do to stop from getting sick in the first place. And so I just want to take a few minutes today to go over each of the, just touch upon each of these 8 areas. And I think of these as maybe a little a hook that we can hang a hat, or a different playground or domain in which we can operate, but they all come together. And that's the idea of something coherent, is how can we take all these different aspects and we get them to work together. And if we decide that there's some interest in doing a more advanced course, we'll get into all of these in great detail. So the first letter is the C, and that stands for colonize, and colonizing our microbiota. Now, back 10 or 20, even 20 years ago, when we started learning about probiotics, we thought that a lot of the probiotics that we might take by mouth are actually repopulating and colonizing our gut on a long-term basis. And what we've learned now is that most of them do not. They're not there permanently. They're there transiently. But what they're doing while they're in the system is they're helping to recruit other microbes that we want to live in there long term. And so there's probiotics, and then there's also prebiotics. And prebiotics are the food basically for the probiotics. And for the most part, we're talking about different types of soluble fiber and resistant starch. And we need to have the right combination of probiotics and prebiotics coming into the system in order to be actually colonizing our gut and creating changes that are going to be long-term, and that are actually going to persist past our treatment. The second one is optimizing absorption. So you might perhaps be familiar with the patient if you do a full dietary intake and you ask them about what they're eating and when they're eating, how they're eating, and everything just sounds pretty good. I mean, there's always room for improvement, but in a lot of cases, I would find that a patient, I really couldn't find much more than maybe a couple tweaks to suggest about their diet, and yet they didn't seem to be getting the benefits that we are expecting them to get from the diet. And if we're seeing that happening, one of the things to look at is actually absorption. So remember that the digestive tract is technically not inside our body. Our body is more in the shape of a torus or a donut shape, and that hole through the middle is our digestive tract. And technically, it's not inside our body. Things that we put into our digestive tract have to pass through a barrier in order to get in. And if that barrier is inflamed, if that barrier is blocked, if that barrier is destroyed, we're not going to be able to absorb the nutrients from our food. And we could be eating the best food on earth, but we're not going to be getting the benefits of that. And so one of the things that we can focus on with the Coherent Method is also what are different ways that we can improve or optimize the absorption of the nutrients and other things that we're looking to get from our food. The third thing is harmonizing our digestion. And what this means is the idea here is if we think about an orchestra playing, there's all of these different instruments. We have the violins and the string section, we have the flutes and the winds, we have the trumpets and the horns, and all of these different parts of the orchestra need to play together and at the right time. And if one group is really being very forward in their playing, and another group is kind of sitting back, the audience just isn't going to get the whole picture that the author of the music was trying to convey. And the same thing happens with our digestive tract and our digestive system. So in other words, there's so many different organs that are involved in our digestive tract. It's not just our mouth, esophagus, stomach, small intestine, large intestine. We also have the pancreas is involved, the spleen is involved, the brain is involved, even the heart is involved, our muscles are involved, our skeletal system is involved. In fact, it's probably would be difficult to think about a body system that wasn't connected into the digestive tract in some way. And that's why we need to learn how to get all of these things to work together. So one example of this, for example, is with indigestion or reflux. What would typically happen when someone's functioning well is that say when you're preparing a meal and you're working with the food, you're looking at it, you're smelling things cook, all of that is being processed by your central nervous system. And what it's supposed to do is send a signal down to your pancreas, to your liver, and to other organs to get them prepared to release the types of things that they're going to need to digest the food, whether that's to break down the proteins, fats, carbohydrates. And then so by the time that the food actually makes it to your stomach and then into your small intestine, those things should already be present. But what can happen a lot of times is when the gut and the brain are talking to themselves, are talking to each other, I should say, that information's coming into your central nervous system, but it's not getting down to your gut. And then what can happen is that you eat the food, it gets down there, and then it's not getting digested the way that we think. So that's why harmonizing digestion, or looking at how to get all these different components working together and how to really zoom out and look at the body holistically as it pertains to the digestive system, is the third component of the Coherent Method. The fourth is to energize metabolism. And what I mean by that is providing the body with a full spectrum of nutritional support. If you recall from your classes, or you've ever had any additional training on biochemistry, and you look at all these different pathways in the body, one of the things that strikes us is how important different nutrients are to these processes. And you can be eating very, very well. You can be eating a plant-based diet. You can be eating mostly organic food, and you can be doing a lot of things that are very right. But if you are leaving just a couple things out of your diet, you may not be getting a critical nutrient that you need. For example, zinc, magnesium, and vitamin E are the three nutrients that are most commonly missing from our diets. And it's quite possible to be eating a healthy diet, but still be missing out on those nutrients. And there's 22 of them. And the point is here that the body needs all 22 in order to be working properly. If you get 21 out of 22 on a test in class, you've got a passing grade. Not only that, but you've got a pretty good grade. But when it comes to nutrition, if you've got 21 out of 22 nutrients, what's going to happen is all of your processes are going to break down around that one thing that's missing. And so that's why it's very important to make sure that we're energizing metabolism by making sure that we're giving the body all of the nutrition that it needs. And especially in the cases where people might not be digesting and absorbing their food correctly, we're going to need to think about some ways to help with that, whether it's cooking food more thoroughly for people who have difficulty with digestion, whether it might be in the form of taking some nutrients by supplement or in liquid form. And the fifth component of the Coherent Method is realizing self-awareness. And this is really where the whole mind-body component comes in. And so a lot of times, again, people might be having difficulty with their moods or with their memory, and they may not have any idea that this could be connected to a process that's going on in their gut. And until we start the process of learning basic self-awareness tools, when we're feeling ways that are not only uncomfortable, but when we're also feeling ways that are comfortable, stopping to reflect and thinking about, what am I feeling? Why am I feeling this? And if we can't really identify a reason why, maybe there is a reason why, but if we can't identify it, maybe it has something to do with something that we're currently unaware of. When we think about tools like yoga or meditation, creative visualization, sound therapy, light therapy, essential oils, all of these things come to play on our digestive function and our digestive health and are tools that we can use as well. But in order to use them effectively, we also need to have the awareness about what is working. And one of the things, for one example I can think of is that, for example, with yoga, Hatha yoga practice has become so popular, and it's fundamentally, we think, what could be wrong with moving and stretching your body? And fundamentally, it's a great idea. But what some people don't realize is that you can injure yourself with yoga, particularly if you're working with a teacher who isn't very trained, or if you're not working with a teacher at all. And also, another aspect is with more intense exercise programs. So, for example, if you're starting a cardiovascular program for your heart, well, this is great for your heart. But what happens every time that you start putting the body into a high output mode is that the blood flow gets diverted away from your digestive tract to your heart and your muscles. Now, this is what it's supposed to do. But if you're a person who's already suffering from digestive challenges, you're going to need to have a lot more awareness about that. You're not going to necessarily be able to just get out of your workout and then go eat a big meal right away. Your body might need more time to recover from that workout until it's ready to digest food again. And those are all components of self-awareness, and there's much more than that. But it comes down to taking the idea of ourselves and who we are and how things work for us personally, and how we can apply specific techniques in a way that are going to be effective. The next thing is called equalizing the terrain, and the imagery that I give here is sort of like preparing the soil. So if you're going to want to plant a crop, and you go out and you just sort of throw some seeds in the ground, if you're lucky, a couple of them might grow. But really, we have to prepare the ground. We have to think about where we're going to put the seed, when we're going to plant it. Do we have worms and other insects that we need in the soil? Are the nutrients present in the soil for the seed to grow? Is there water? Is there too much water? Is the water not frequent or infrequent enough? All of these things have to do with thinking about the terrain. So again, with Colonize, we're thinking about what we're just putting in terms of prebiotics and probiotics. Equalizing the terrain has more to do with preparing the gut tissue to receive these things. And this has to do more with the insoluble side of fiber, which is the ones that neither we nor bacteria can digest, but act as little scrub brushes to get in there and sort of clean out the remnants of digestive process that might be lurking in our system. So we're thinking about equalizing terrain, and also one thing that's oftentimes overlooked is the importance of water. And so just simply getting enough water into our system so that way enough of it makes it into our colon to be able to flush out the things that need to get removed. So one thing that happens, for example, is if we're not getting enough flow through our colon, then we get reabsorption of toxins, right? So the things will go through the liver, they get to the liver, and the liver packages them for removal. And one of the biggest top areas of removal of toxins is through the colon. But what will happen is if the liver does the work, it sends things out to the colon, and then they don't get removed but get reabsorbed, they end up back in the liver. And when things end up back in the liver, then the liver is going to need to decide, what are we going to do with this now? And sometimes it will actually take those toxins, it will package them, send them off for storage inside fat cells. And that can be problematic for a number of reasons. One is not only it can make it more difficult for people who are trying to find a more ideal body weight to actually burn fat, but that when the fat is actually getting burned off, these toxins are being re-released out into the blood, and it's causing all sorts of other side effects and problems for people. Another thing that can happen is that the toxins get repackaged and sent out through the skin. And until very recently, this is something, I mean, in naturopathic school, we were taught to think about the skin as an extension of the gut. But in terms of medicine in general, this is a relatively new concept. It's been confirmed with research now, but that things will actually get repackaged and sent out to the skin. And so sometimes, especially if a person doesn't have a lot of awareness around their digestive tract and what's happening, the first sign they might really have that they're aware of digestive problems is eczema or a breakout of acne or a rash on their skin. And if they just go to the dermatologist and the dermatologist gives you a cream or something to just suppress the symptoms, then the rash clears up, but nothing was done to correct the issue in the gut. And what will happen is that the thing will recur after time. And especially when we're getting a recurrence of skin symptoms, that's when we really need to start thinking about the terrain and what might be going on with the actual gut tissue itself. The seventh aspect is of the Coherent Method is neutralizing invaders. So the body is if we were able to see or visualize the microbes, the viruses, the allergens, and other antigens that are constantly coming in and around the body, we would just simply be overwhelmed. It's a miracle that the immune system can function at all with this. And normally, a certain amount of these are to be expected and shouldn't be big of a concern. And what I mean by that is we're getting into a reversal of the trend now, but back in the 80s and even early 90s, there was the idea with microbes was, let's just spray everything down with bleach and use bleach wipes. I know in the US right now, it's a big story that bleach wipes are just becoming available again after a shortage due to coronavirus. And again, it's getting back to that first slide where we talked about the idea of just killing the microbes or deactivating them. And really, ultimately, that's a losing battle. We certainly don't want to have scenarios where there's an overgrowth of microbes, but we want to be able to tolerate them to a certain level, but neutralize their effects. And so this is what we're talking about here is how, with the neutralizing invaders, is how can we use, for example, herbs and nutrition and other practices to neutralize the effects of the invaders, rather to get to that second point, which is reducing the effects that they have on our body. There's a whole revolution going on right now in terms of what really is an infection. Because we used to think, well, if we see a certain microbe in the body, and then it causes an infection. But what we're finding out now is that many people can carry a particular microbe in their body and, of course, not be sick. But that might not stop them from transmitting the organism to another person who does get sick. Or even when it comes down to the microbes themselves that make part of our microbiome, some of those things are actually traditionally considered pathogens, but we find them that they're present in a very low level in some people, and that actually when they're not present, like certain strains of Clostridium, we might think, oh, well, let's just get rid of those things. But what we find is that when we actually get rid of those things, that they were competing for a space with something else. And when we remove that one thing, something else just comes into that space and causes another problem. So in Neutralizing Invaders, we're thinking about how can we tolerate invasive species without allowing them to take over the show. And then finally, the last component of the Coherent Method, the T, is tranquilizing gut tissue. So what happens is, in a lot of times with functional digestive disorders, is that the gut becomes hypersensitized. One of the things that can happen is that actually it's the nerves, the central nerves that are going to that particular gut, section of the gut, that have become hypersensitive to a certain stimulus. So, for example, people might complain of a lot of abdominal distension and feelings of pain and discomfort and gas. But when we examine them, we see their abdomen isn't distended. And if we ask about how often are they passing gas or the volume, it's actually pretty normal. What may be happening in situations like that is that the pain receptors to that part of their digestive tract, when the gas passes through, has become so sensitized that even a small amount of gas or other material that's passing by can cause pain and discomfort. Another thing that can happen is with the vagus nerve. So the vagus nerve is the main distributor of our parasympathetic response. And a lot of times, people who have functional gastrointestinal disorders might also say that they suffer from panic attacks, or that they have other symptoms of anxiety or difficulty breathing, and they might even be seeking psychological or psychiatric help for these things. And in a lot of cases, what we found that what was actually happening is that they had a tiny hiatal hernia. So there was just a little tiny bit of their stomach that was actually herniating up into their esophagus. And what happens is that this is right in the area where the vagus nerve passes through the diaphragm, and it's getting pinched. And one simple physical maneuver to help reduce that hernia, and all of a sudden, people who were suffering from anxiety and panic attacks weren't having them anymore. And so, and now I'm not suggesting that that's, of course, always the reason why, but it's something that we need to keep on our radar, and learning about different ways that we can tranquilize the gut tissue and let it return back to a base level. Because what will happen is that it just gets more and more and more easily stimulated until we get to this point where almost anything, or just food itself, starts to upset the digestive tract. And this can cause a lot of problems, and not just for the patient itself, but actually managing the case. And one of the other areas that this comes into play is when we start talking about food sensitivities. So if you've ever worked with a patient and you start doing tests around food sensitivities, and then over time we see that we're just getting boxed in closer and closer and smaller until I can only eat 3 things. I can eat, jasmine rice and almonds, and I can drink milk. Well, we're going to run into other problems. It's not going to be a permanent solution, because we're not going to be able to get all of our nutrition from those foods. And what can happen is that the tissue is just still getting triggered. And so whatever you put into the body just causes the next wave food sensitivities. And so we have to start thinking about how can we lower the sensitivity overall itself. And so those 8 parameters: colonize, optimize, harmonize, energize, realize, equalize, neutralize, and tranquilize, are the 8 different areas of the Coherent Method where we can work with patients that have functional digestive disorders.
That's great, Dr. Matt. You mentioned that the hospitalizations increased considerably. Why do you think? What is the reason in the from 1993 you mentioned to 2013, so many hospitalization people would go in just for constipation and abdominal pain? Was it like a combination of food or lifestyle? I mean, what happened during those years, you think?
Yeah, well, I wish we knew for sure, but I think that part of it, no doubt, especially with the research that's coming out now, is just the increase of highly processed foods in our diet. And it's really only been in the last couple of years where we've had research demonstrating that these things are actually harmful. And part of it was just the introduction of massive amounts of new chemicals and additives into the food. If you recall, back in the late 80s and early 90s, if you went to the store, the corner store, they'll have some candy there at the checkout aisle, and maybe they have a Hershey bar and some M&Ms and a couple kinds of chewing gum. And then all of a sudden, it seemed almost overnight, there was not just one Hershey bar, but 6 different kinds, and 3 different kinds of M&Ms, and 12 different kinds of gum, and candy that fizzed in your mouth, and different colors that we've never seen before, right? And the way that I explain it to patients is that when your food acquires a feature, that's a chemical. That's a chemical that was being added to the food that wasn't there before. And so I think that, just the addition of all this new stuff into the system, especially the microbes haven't seen any of this stuff before either, is part of it. A second aspect just has to do with more of the stress and that sort of fast-paced lifestyle that we've all, I think I'm hoping that we finally turn the corner on that. But for a long time, it was just seen as a person's value was so tied up in with how much we do and how much we're accomplishing and go, 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 go. And for example, even at work, whereas people used to take a full hour or even longer to take a leisurely lunch, relax a little bit, and then get back to work in the afternoon, it became expected for many of us that we were going to take a working lunch, or we're just going to be sitting there at our desk and putting food in while we can. And we get home and we eat really quickly with this is another one, eating at the dinner table with the nightly news on. So we didn't understand that there's different modes. Well, we did understand, but we didn't fully implement our understanding that there's different modes to the nervous system. And if our brain is very stimulated, if we're typing out emails and checking our feeds, and if we're sitting at the dinner table and we're hearing about all the most awful things that happen in the world that day, our digestive system is not ready to prepare to be fed. And so we're putting food into an environment that's not ready to receive it. And I think that's one of the second thing that's probably one of the biggest factors to that. And I think that the third thing would just be the cumulative effect of what happens with patients, wherein over time, months go by, years go by, and their symptoms are just ratcheting up and up and up, and they go to their primary care doctor. They don't get any better. They go to see a specialist, and they can't help them either. And it gets to a level where the symptoms get so severe, and also they're so frustrated that it becomes a crisis. And so it just blows up one day. They've had it, and they're going to the hospital, and they're going to go to the emergency room and demand that somebody help them. And while that's understandable how that would happen, it doesn't really help the patient at the end of the day, because where they need to really be getting help is back in that primary care setting, and then with the gastroenterologists that hopefully now are recognizing these things a little bit more. Before the year 2000, really, people with functional gastrointestinal disorders were just literally told by their gastroenterologists, well, we can't find anything wrong with you, so it's all in your head. Or
Yeah.
maybe go see the psychiatrist and get on some psych meds. And the crazy thing is that, well, sometimes the psych meds worked. And now we understand why. They at least help people feel better. They didn't really deal with the problem at a fundamental level, but this reinforced the bias that, well, maybe you're just a little bit crazy, or we can't find anything wrong with you, so best of luck. And so people just are sent back out into the world and continue to get frustrated. This impacts their lives, it impacts their families, it impacts their work, and it just gets to a point where it sort of blows up, and then they end up in the hospital one day. So I think that those are probably the three main reasons that we've seen so much more of this over that time period.
Yeah. That makes complete sense. So hopefully now, with so much education about natural therapies that's out there, I think everyone knows about yoga, everyone knows about eating properly, eating healthy, organic. So hopefully in the coming years, these problems should start getting in control. I think there's a lot of awareness now with all the things that you've been talking about in a scientific language, but most of us are now aware of we should we should eat good food, we should exercise, we should do all these things. So hopefully some of these protocols that you talked about would fit into your protocol, that we're harmonizing it, What do you think of that?
Yeah, I think so. Again, I think that at least when I started this project, I had so many different ideas just bouncing around in my head, and so there's a lot of tools. And so that was the first stage, I think. Well, the first stage is just acknowledging that this is a real problem.
Yeah.
And then the second was developing all of these tools. And then the third stage is, now that we have all of these tools, well, which ones do we use in which situation? And also, what order do we apply them? Which can make a big difference, especially when you're working with a patient who's really been suffering for a long time. Sometimes we want to do the things that are going to help them to get feeling better, so that way they can get some positive momentum first going, so that way they keep coming back, because they've been so frustrated. Usually they've seen 10 or 20 different doctors, and if we're not able to give them something right away that can help them, they may not come back. But on the other hand, really helping them to get better is going to take some time, and it's going to take some tools that might be a little bit more complicated. And so this idea of how do we take these different things and decide when and where to apply them, I think is the stage that we're in right now.
Okay. Well, thank you so much for being with us. And thank you everyone for watching. Please, yes, absolutely. Share the sessions. We have a lot of educational sessions, so please share on Facebook and with your family and friends. I'm going to sign off. Thank you so much, Dr. Matt, for being here.
All right, thanks again, Amita. All right, have a great day.
Thank you. Bye-bye.